Calming the mind is yoga, not just standing on the head. Namaste, friends. I am Ritesh, and today we will complete our fourth and the last part on yoga hip alignment. That is, when to use anterior pelvic tilt in yogic asanas. And the asanas that we will cover today are Dandasana, Janu Sirshasana, Uttanasana. So please watch this video completely to understand yoga hip alignment. So we have already covered first part, what is anterior and posterior pelvic tilt with anatomical explanation. The second part, when to use posterior pelvic tilt in yogic asanas. The third part, how to fix your anterior pelvic tilt. It's great to be aware of these alignment while you do your personal practice as well when you teach and learn to explore. When you practice Surya Namaskar or Vinyasa flow, you always find a lot of forward bends or forward flexion. And for some people that feels great. That is the sensation of surrendering and stretching the hamstrings. While many yogis feel discomfort when flexing forward and feel disturbed when they cannot touch their toes. As if touching the toes will lead them to moksha or samadhi. Please remember, friends, it does not make a huge difference whether you touch your toes or not. Neither will you achieve anything, nor will you get moksha. But yes, you will get a back pain for sure. There are certain alignments to be made so that you can flex forward or fold forward safely without any discomfort at the lower back. When you move into Dandasana, Janu Sirshasana, Paschimottanasana, Uttanasana, or in fact any of the forward folds, whether seated or standing, it's advisable to move your sitting bones back in space, in other words, and anterior pelvic tilt. Even if it is subtle, moving the sitting bones back initiates an anterior tilt of your pelvis and allows your pelvic to tip forward over the femur bones. When the pelvis tips forward, the hamstring lengthens and the quadricep shortens. There you have a forward fold. If you find that your lower spine is very rounded in your forward fold, experiment with sticking your butt out way behind. As you can see here, sticking the butt out helps the lower spine lengthen. When you do the opposites and you curl your butt under, that is a posterior tilt, you cause the lower back to round. The position of the pelvis is everything as it informs the rest of the spine how to move. Suppose you start practicing an Uttanasana. It's possible you and your students have reached your maximum hip folding capacity and now you feel restricted, you can't go more forward. Often this is a result of a combination of tightness and weakness in the muscles. Muscles likely tight are your hip extensors, that is your hamstrings and the gluteus maximus. Muscles that are weak are hip flexors, psoas, rectus femoris, adductor group. I have already talked in great detail in my previous videos on hip alignment. So when you practice forward bends, it's because of the tightness in the hip extensors that creates an unwanted posterior pelvic tilt. In yoga classes, injuries to lower back is very common. In this session, we will look particularly at seated forward bends and how to move the pelvis in a way that promotes healthy alignment. Regardless of which seated forward bend you are doing in yoga. The common theme is that our seat is anchored on the ground. So it becomes very easy to move our bodies forward without the pelvis with us. This is especially true for people with tight posterior legs and hip muscles. When the pelvis gets stuck in a posterior tilt and we lean forward, it can place strain on the ligamentous tissue around the sacroiliac joint, often referred to as SI joint, and can cause excessive rounding throughout the spine, which is potentially dangerous to the disc of the lower back. So, a very important skill to learn is how to tilt the pelvis forward, that is, anterior rotation with the spine in our bends. So now let us focus on the asanas. Here are some tips to learn how to do this. So first one is sitting on a block, bolster or a blanket. Friends, even if you are meditating or just casually sitting in a cross-leg position, it's recommended that you always sit on a block, blanket or a bolster. So anything that makes your pelvic higher and the knees lower, it always safe for the lower back. So yogis with rounded spine should sit on a block as it assists your pelvic into an anterior tilt, which could help you lengthen the rest of the spine. Friends, I have been encouraging a lot of my students with rounded spine to sit up on a block when you sit forward. Let's take an example of Dandasana. Let us now focus on Dandasana. Check your position in Dandasana, that is staff pose. If you see here, the pelvis is fixed in posterior rotation and the spine having to compensate in a really rounded posture to make the bend happen. To avoid this potentially straining posture, we utilize props to assist in the tilting of our pelvis in the anterior direction. If you are unable to sit with sacrum tilted slightly forward after the legs being stretched or extended out, or if your pelvis is going into a posterior tilt, that is, pelvic tips backwards, and the tightness in the hamstrings and the glutes are preventing you to sit straight, then the tip here is avoid sitting on the ground. In fact, sit on a heighted position, that is, sit on a block or a bolster or blanket, so that your hip is higher than the knee. If you are unable to sit with sacrum tilted slightly forward, increase your prop height until the pelvis is neutral. Work from there to elongate the spine. Number one, roll mat or towel under the knees. So let's take an example of Janu Sirshasana. Below, I am demonstrating Janu Sirshasana, that is a head to knee pose where one leg is overstretched and the other knee is bent. I modify by placing a folded blanket underneath my seat to reduce the pull of the hamstrings. Note, more than one blanket can be used depending on the level of tightness in the legs. Also, a rolled towel placed underneath the knee to fill the space and reduce the strain, the posterior knee strain. You can see how this has changed the posture of my lower back. Safe and effective forward bend begins with a focus on anterior tilt of the pelvis. This is critical for countering the common tendency of folding from the lower back, which places too much pressure on the lumbar spine. Supine positions are safest for forward bends. Forward bends from the back, such as Apanasana, that is knee to the chest, also known as Pavan Muktasana, and Supta Padangushtasana, that is reclined hand to foot pose, are the safest type of forward bends for tight hamstrings and of back issues such as disc injuries. The final tip: lengthen the hamstrings over time. You can practice targeted hamstrings lengthening with Supta Hasta Padangushtasana, that is reclined hand to big toe, wherein the hand is extended into reach by a strap, as well as several other common asanas including Adho Mukha Svanasana, that is a downward facing dog, Uttanasana, that is intense standing forward fold, Parshva Uttanasana, that is intense one side standing forward fold. You probably get the idea Forward folds help to lengthen the hip extensors, hamstrings and your gluteus maximus. Add knee flexion. Let's do an Uttanasana and see how we can add anterior pelvic tilt. A healthier pattern to practice in forward fold is to create an anterior tilt in the pelvis by flexing the knee. But if you are already anteriorly tilted, then please do not bend your knees. By lifting the sacrum and rotating the pelvis anteriorly, the practitioner creates a smooth, integrated transfer of force throughout the spine as a unit. By rotating the sacrum and lower back to be in the same plane of force as the thoracic and cervical spine. We call that neutral spine in one straight line. Extending through the crown of the head elongates the spinal column. Friends, if you do not touch your toes in forward flexion or you cannot do a Sirshasana, that is a headstand, it does not mean that you are not a great yogi. Friends, yoga shouldn't make you feel inferior. Yoga shouldn't make you feel inadequate. Your yoga practice and not your competition is there for you to be in your body and better understand who you are physically and mentally. In fact, there are many asanas that I cannot do, and that's fine because I understand my body. I know myself, and that's what inner journey is all about. Thank you for watching. Take care. Keep smiling. Namaste.